I'm here to introduce Quantum Foundation to some of you and reintroduce Quantum Foundation to the rest of you. Our mission is to advance health, education, and community betterment in Palm Beach County. I am, by the way, joined here today by our new Director of Community Relations, Tony May, who is in the back and waving right now. You all undoubtedly know her from TV. We've got some goals for Palm Beach County, and as a health funder, and primarily a health funder, we're looking for a healthier population, a medical home for all of our residents, a coordinated and collaborative healthcare delivery system, increased numbers of health professionals, increased health sciences competency, and improvements in the quality of life from the neighborhood level on up. Our place in the community really is one of collaboration. We don't think that there's much of anything that we can do on our own, though we think there's a lot that we can do collectively. So we do all we can to achieve impact by investing and engaging in and with the community on a lot of levels. And I'm going to talk with you a little bit more about that and the importance of that. Right there, the number's not all that important, but that big block of the pie represents people who have no access to health care in Palm Beach County. And you've heard about that before, but whether or not you see that is the number that's attached to that, and I did this slide initially for another purpose, or whether you look at an expanded number, the basic percentage of about a quarter of the people here who are in need of safety net services not having access to them because they aren't available is a real number in Palm Beach County. As a result, our health focus areas focus to a great extent on public health efforts, healthcare services with a solid business model that can provide acute and chronic care to people who are primarily underinsured and uninsured, and strategies that promote a coordinated healthcare delivery system because we need to work together to deal with this. In the area of education, we are primarily interested in health and health sciences education. We're interested in that from the earliest levels of educating young people all the way up to postgraduate education. And that is an area that, though, is very closely aligned with our area of interest in health, as is our area of community betterment. We are looking in community betterment at a category that many people who approach us for funding think is an extraordinarily broad category that is anything that they may judge would improve the community or any community in Palm Beach County. That's not the case. For us, it's community betterment really as it ties to addressing root causes of public health problems or health problems in the population. We have some special initiatives that I wanted to share with you that are now ongoing in their second year. The Federally Qualified Health Center Initiative is really the basis through which we are working on access to care funding these days. Since 2005, we've put about $6 million into free and volunteer clinic services in Palm Beach County. We started talking at that time about our belief that we would be unable to sustain the amount of funding into that system that we were placing or putting into it. But we felt that the Federally Qualified Health Center model would be a business model that would allow us to move forward in partnership with people in the community. And in just the last couple of years, most of that $2.2 million has been committed to federally qualified health centers, and we're going to continue to invest in these. We believe that to deal with that quarter of the people in Palm Beach County who have effectively no meaningful access to comprehensive primary care and the services that surround comprehensive primary care, that we're going to have to do that through the establishment of a foundation of federally qualified health centers, both in the public sector and private sector in Palm Beach County. Just in the last month or so, we announced our next round of grants, the next 3 grants, to J Ministries to develop a center in Boynton Beach as fiscal agent, to Community Health Center West Palm Beach, formerly known as Samaritan Gardens, to develop a community health center federally qualified in the Westgate section of West Palm Beach, and to the Palm Beach County Health Department to develop a new federally qualified health center in Riviera Beach, 3 of the areas that remained with greatest need. We have been assisted in this endeavor by Earl Fox and his staff at the Florida Public Health Institute. Earl's in the audience as well. And anybody who is looking for the national expert on the federally qualified health center program ought to remember that they've got him in the room right now, and don't let him out before talking with him. And Earl's sitting right there. In addition, our neighborhood initiative has really given us an opportunity to invest in that neighborhood that surrounds the building that you can see in the background of all of these slides, our new home in the North Australian Avenue part of West Palm Beach. Essentially, that area east of 95 and west of the Intercoastal, north of Palm Beach Lakes and south of 45th is an area of special interest to us. And we've launched the Quantum Neighborhood Initiative in order to provide significant new grants to collaborative enterprises that are led by some of the smaller nonprofits in that neighborhood and public agencies in that neighborhood to improve circumstances in that neighborhood. And I would call your attention to that program as a continuing opportunity to partner with us in making a difference in a neighborhood which is an important neighborhood to the community of West Palm Beach, central to Palm Beach County, and of course of significant interest to the foundation.